Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Examples of stimming. Examples of stimming include flapping one's arms or rocking back and forth, which are often seen in people diagnosed with autism spectrum disorder, ASD. Stimming describes self-stimulatory behaviors that involve repetitive movements or sounds. /r/n/r/n You don't have to be autistic to stim. For example, tapping your foot when you're nervous could be an example of stimming. Stimming does look different, though, when it's an autistic trait. Behaviors like finger flicking and twirling can become excessive and/or obtrusive in an autistic person. /r/n/r/n This video has been medically reviewed by Rochelle Collins DOrnrn Stimming suggests repetitive behavior that goes beyond what is considered culturally or socially acceptable. /r/n/r/n For example, nailbiting and hair twirling can be distracting but are usually acceptable in most social situations, like at work or school. Handflapping or spinning in circlesstimming examples that are common in autistic people are less socially accepted. /r/n/r/n Other examples of autistic stimming include /r/n/r/n People who are not autistic, neurotypical, usually stop stimming when they get a strange look from someone or otherwise recognize that their behavior is drawing attention. Autistic people perceive social cues and body language of people around them differently. Since they may not pick up on others' reactions to what they are doing, they may stim in situations where it's considered socially inappropriate. /r/n/r/n Although there is some debate about the actual cause of stimming, most experts consider it a tool for emotional self-regulation. /r/n/r/n Autistic people often have sensory processing challenges. Depending on the type of response to stimuli this causes, they may overrespond or underrespond to things like sounds, light, textures, and smells. /r/n/r/n For example, with a hypersensitive reaction, they might be overcome by a strong odor and experience sensory overload. With a hyposensitive reaction, someone might not react to or even notice a loud noise. /r/n/r/n In these sensory situations, stimming can, /r/n/r/n Autistic people may stim in certain situations and in the presence of certain types of sensory input. Examples of stimming triggers include /r/n/r/n Many autistic people stim when they're excited and happy, not just to diffuse feelings of being overstimulated or distressed. While most stims aren't harmful, some behaviors can be. /r/n/r/n Stims that may need to be managed to prevent physical harm include /r/n/r/n Stimming can also become a problem if behaviors persist for hours or become a daily occurrence. In these cases, they may cause distress and further impair the ability to self-regulate emotions. /r/n/r/n These stimming examples often reinforce the stigmatization of autistic people. Potentially harmful stimming behaviors may continue and get worse if someone feels ostracized or alone. /r/n/r/n Some of the reasons why autistic people stim are shared by people with attention deficit disorder, ADHD, who stim. A person with ADHD who is fidgety is often trying to self-regulate their need for stimulation in a situation where they are not feeling stimulated enough. /r/n/r/n There are also some differences. For example, an autistic student may stim in class because the light and sound in the room are overwhelming, while a student with ADHD may find that stimming helps them focus. For other people with ADHD, stimming simply becomes a habit. /r/n/r/n There is no reason to stop an autistic person from stimming if it's not causing problems. It's only when stims are very disruptive, such as in a school classroom, or dangerous, for example, causing injury, that they need to be managed. /r/n/r/n Very well, Brianna Gilmartinrnrn It can be hard to change stimming behaviors. caregivers may think punishing an autistic child when they stim will make them stop, but it can actually make the situation worse. Punishment ignores the core reason that a child is stimming. /r/n/r/n Remember that stimming is a tool for coping. It is not bad behavior, it's not even necessarily an intentional behavior. /r/n/r/n There are a few techniques for helping an autistic person manage stimming. /r/n/r/n While it's a central feature of autism, stimming itself is not a disorder. /r/n/r/n Diagnosing autism can be difficult. There is no single medical test that can specifically identify it. As a spectrum disorder, autism presents with a range of traits and support needs in different people. /r/n/r/n The diagnosis of autism is made based on criteria that are outlined in the American Psychiatric Association's APA, Diagnostic and Statistical Manual, 5th edition, DSM-5. /r/n/r/n To be diagnosed with autism, a person needs to have traits that lead to persistent challenges in all three of the following DSM-5 criteria. /r/n/r/n Diagnosis also includes expression of two of the four following behavior patterns, assessed in terms of the support needs required. /r/n/r/n Stimming does not need to be medically treated unless it is harmful to the person or people around them. For example, aggressive behaviors like head banging or hand biting, or actions like nail biting, self-scratching, or ear clapping can cause physical injury. /r/n/r/n Speak to a healthcare provider if stimming behavior fits this description. They may suggest making changes, such as taking medication if not already prescribed. /r/n/r/n Stims are behaviors like rocking, hand flapping, and repeating words or phrases. Autistic people engage in stimming to help manage their emotions or block out overwhelming sensations. /r/n/r/n Stimming does not need to be treated unless it is constant, disruptive, or causes harm. In these cases, behavioral therapies, environmental changes, stress reduction tools, and even medications can be used to help manage stimming while a person learns skills to regulate their emotions. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.